Okay, wonderful. So welcome to the 2020 annual workshop on ethics and professionalism, adapting to change. We're really pleased to be here with you today for part two of our part two workshop series. In terms of adapting to change, doing these workshops are a change for us as well. And we hope to generate the same level of enthusiasm and shared learning like the in-person sessions, minus the fruit tray and coffee, of course. So for the next hour, we'll be reviewing 5 practice scenarios, and we'll apply strategies to address change in practice using the professional practice judgment framework presented in the pre-recorded webinar. So the purpose of today's session is to provide an opportunity to look at common practice scenarios, so the 5 of them, and how you can apply the professional judgment framework, including approaches to how you might use resources to help dietitians and your colleagues in decision making. So we hope by the end of the session today, you will leave with an applied understanding of professional judgment using the framework when dealing with change. So this has been a year of change. We're living through a pandemic. We know that dietitians are dealing with questions that are evolving as the environment is changing around us. And we thank you for your work. In the recorded portion, we discussed what it means to exercise professional judgment when adapting to change. We looked at how to adapt to change to enable safe, ethical practice, and how we can use our professional judgment to get us there. So on the slide is the framework for applying professional judgment when adapting to change. And the framework includes 4 components, the first being knowledge. So when we think about knowledge, good judgment requires that we turn knowledge into understanding. So decision should be based on evidence. The second component is client input, and this refers to client-centered services, but it also refers to understanding ourselves. So refocusing one's behavior, attitude, awareness, skills, and considering policies to best serve the interests of the clients we serve. The third component is professional obligations, and this refers to the way that we practice. So practicing safely, competently, and ethically, and also considering legislation, our code of ethics, and risk assessment. The fourth component of this framework is experience. And by experience, we mean our practice wisdom, our reflective practice, and our ability to reflect in and on practice, as well as how we manage stress and our resilience. So with professional judgment, we have to be open to see all perspectives and all components, as sometimes we might get caught up in just 1 or 2 of these components. So at this point, I will pause a bit to see if you have any reflections on this framework or any reflections on the pre-recorded webinar. So feel free to add to the chat. Are we seeing anything on the chat?
Yeah, so one comment is about the practice wisdom piece of the experience component of the framework and how it's been helpful as to think about one's practice wisdom circle. Thanks for that.
That's good. Yes, thank you. And we've heard that in the other workshops as well, that practice wisdom seemed to resonate with many of our dietitians. Okay, so I'm not sure if there's anything else, but maybe we can jump right into our scenarios. So
there's one more comment, Carol, just commenting about the session being helpful, like the pre-recorded webinar. So thanks for that, and helpful to structure thoughts and reflections. So okay. I think what I'm hearing is using the framework, because I guess we don't often think about professional judgment. It just happens on autopilot. We just do it. So breaking it down has been noted in the chat as being helpful.
Excellent. And feel free as we go through the scenarios to add your reflections as well. Okay, so let's get right into our scenarios. Scenario 1, would you like to take the lead here, Diane?
Yes, thanks, Carol. So with the scenarios, there are no right or wrong answers. We're really looking for an opportunity to have discussion, to hear what your thoughts are, to reflect and to apply the framework. And this first scenario, we situated it in an area of practice for context to help in terms of describing the scenario, but it could apply to any area of practice. So if it's not your area of practice per se, please just reflect on the concepts that the scenario is about. So this one's about redeployment and personal scope. So this is a dietitian who has been working in a practice setting for 5 years, and their manager informs them that they may be redeployed to assist with tasks that are within their scope as a dietitian, but not within their typical area of practice. And the example that we gave is someone who has been working in an outpatient setting, but is being asked to take on some work in an inpatient unit. The dietitian feels concerned that they don't have the competence to take on the work and that it may be out of their individual scope of practice. So together, what we're going to do is answer the 3 questions you'll see here on the slide. What are the issues? And what components of the professional judgment framework apply in the scenario, and how the dietitian may handle it. We're going to take them one at a time, and what we're going to do is something called a chat storm. So a chat storm is like a brainstorm, but what we're going to ask is that you reflect on the question, take about 30 seconds or so to think it through. We're going to set a timer. And then when we say go, we'd like you all to enter your thoughts simultaneously. And then we will moderate the chat and kind of look at the key themes that are coming through from the group. Okay, does that sound okay to everyone? All right, so why don't we start with our first question? We'd like you to think what the issues are. And I'm going to set the timer for 30 seconds, so don't enter your thoughts quite yet. Just take some time to think it through, what you think the issues are. Okay, that's 30 seconds are up, and we'll just take a look at what concepts are coming through in the chat.
I see a theme here.
Yeah,
There's
Samantha, what do you
a
think?
lot of people in the chat highlighting lack of knowledge and skill, lack of competence, the dietitian's confidence, may need to brush up on more information. It's coming in fast and furious. They may have to discuss with their manager. A lot of people talking about scope of practice.
Yeah, we've definitely heard that in the workshops. Today is actually our final session, and we've heard over the past 6 months, you know, questions of personal competence and individual scope, thinking about knowledge and skill that the dietitian may need to refresh, or, you know, maybe there's a bit of rust remover if it's been a while. We've heard about training needs. We've heard about meeting client needs safely. So definitely common themes that we're hearing from the group today. So great job on the first question. Any other thoughts, Samantha, that you're, any other ideas that are coming through from the group that you want to share at this point?
Yeah, there is some interesting comments where they highlighted perhaps having a discussion with your manager about what would be offered in terms of learning and education, and just patient safety was highlighted as well. And yeah, mostly the trends are about lack of experience, competence, and confidence skills. Will clients trust me? All really interesting questions people are asking here.
Yeah. I know we've heard in one of the workshops that there was a comment about, you know, sometimes, you know, when change is driven by us, like we may change areas, we may work in different practice settings, we feel that sense of control. But when changes are happening that we don't often have a lot of control over, it may feel a little less comfortable for us, right? So the confidence piece playing in, and of course that would be on an individual basis, but we've heard throughout this pandemic, many dietitians working with their colleagues, working with their employers, being open and honest to identify what their training needs are, and then working with their employers to set a plan for training and support and mentorship also from colleagues, of course. So yeah. Anything else, Carol, that you'd like to add?
No, I think from the other workshops, when we get this question, we usually guide our members towards a resource that we have called the role and task framework, and that framework actually asks 4 questions. So if you're asked to do something, you ask yourself, is this new task or role within the dietetic scope of practice or practice in dietetics? And obviously in this scenario, it is still within dietetic practice, but then you ask yourself, are there any legal barriers restricting the dietitian from doing this? For example, a controlled act. And then the second scenario, we'll actually talk about controlled acts. And then the third question asks, will the dietitian be required to have any additional skills and competence to perform the new task? And I think this is what we're hearing from the chat storm. It's around the additional skills and competence. And the last question in that framework was, what are the interprofessional care team possibilities? So would it be the dietitian, or could it be the dietitian in collaboration with someone else, or exploring that interprofessional care?
Great. Thanks for that explanation, Carol. I know we've used that tool very often during this pandemic when dietitians are facing new tasks in practice, and I've shared it in the chat for everyone. 4 great questions to reflect on whenever there's something new. If you're not quite sure, is this something that I could be doing? It can be really helpful to go through those 4 questions. To add to that, I think just to, I've heard comments already from the first question, what are the issues? You've highlighted a lot of really important components of the framework. Does anyone have anything else to add in terms of things that are speaking to them related to the framework, about what parts of the framework could help us in this situation? Anyone would like to expand or add anything aside from what we've talked about? So we've talked about knowledge, we've talked about client safety, our obligations like training and risk assessment, ensuring that we're following that, and experience, mentorship, working with colleagues, working with our employers. Anyone want to add anything? And Samantha, maybe you can tell me what's coming through in the chat.
I think one of the first comments came through is very relevant to the pandemic in terms of managing stress and resilience.
Mm-hmm. 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 No doubt.
That's really important.
Mm-hmm. Yeah, it can feel, we might experience a bit of fear, right, as we're facing new situations, for sure, and how that could be stressful.
Mm-hmm.
Yeah. Thanks for that comment. So I think in going through the first 2 questions, we've kind of already sort of answered how we might handle it. But if there's anything that anyone would like to add about how they, if you've had this experience during the pandemic and you want to share your own practice experience, we welcome that. If you'd like to add any comments in the chat, any thoughts or ideas from the group on how we might handle these situations.
I think another component that's really important that I think some people have highlighted is just the notion of reflecting. And it sounds a bit wooey to think about this, but it's such an important part of our practice. And so reflecting on what's being asked of you and sort of looking at the framework. I love this framework because one of the early comments identified, that there is, it feels like you have some structure to work with. And I think that's really important, especially when you're being pushed into uncertain territory within your practice. So yeah, I love that idea of like reflecting on it, especially now when everyone's feeling so much is being asked of us.
For sure.
Yeah. And
Good
I
point.
really appreciate and like the comment about resilience.
Mhm. Good. All
Okay,
right.
so should we move on to the second scenario?
Yes.
Okay. So the second scenario also deals with redeployment. And so you're a dietitian. I'm going to read it for anyone who's on the phone. So you're a dietitian working in public health, and you're asked by an employer to provide contact tracing, which includes providing COVID-19 test results. You wonder if this includes a controlled act, and more specifically, the controlled act of communicating a diagnosis, which is communicating to the individual or their personal representative a diagnosis identifying a disease or disorder as the cause of the symptoms of the individual in circumstances in which it is reasonably foreseeable that the individual or their personal representative will rely on the diagnosis. So again, what are the issues? What components of the professional judgment framework will apply? And how might you handle this? So I think we can use the chat storm again. Maybe 30 seconds to think about what are the issues here. And then when Diane says go, you can all enter it at once. So timer.
I've started the timer. So.
Thank you.
All right, when you're ready, go ahead.
They're coming in.
All right.
What are we seeing?
So I am seeing a lot of people highlighting the notion that about delegation, and is there a delegation of authority, that providing a diagnosis is a controlled act. Someone highlighted liability in communicating a diagnosis. Someone's reflecting on whether there's a medical directive. Let's see what else is there. Being able to handle follow-up questions appropriately. The client may have further questions about COVID-19. Someone highlighted client safety, scope of practice. So a lot of people highlighting this. This is really well done. You're identifying all the right issues.
And similar issues to what we heard from the other workshops. And I think already trying to apply the framework from what you're saying.
That's right.
So pull the framework up here. So in terms of trying to make a decision around this, I heard professional obligations in terms of if this is a controlled act, what do I need to get to be able to do this? So if the organization determines that communicating the results falls within a controlled act of communicating a diagnosis, then a dietitian will require the appropriate authorization, which is a delegation. And I think that came out in the chat as well. And a delegation can happen through an order, a direct order, or a medical directive. So that's great. Any other comments around the framework?
Nothing new.
So in December, our council approved the latest standard that we have on practicing through a delegation of a controlled act, which really outlines the professional expectations that's required when practicing through a delegation. And so I think that resource would be an excellent resource to look at. There are 5 standard statements that talks around competence, which is the knowledge, the client-centeredness around consent and record keeping for the professional obligations, and then bringing in your experience in terms of whether you feel that you have the appropriate knowledge and support from your organization to accept this authorization.
Thanks, Carol. I've just shared it in the chat for the group.
Perfect.
Yeah,
Perfect.
totally.
And I think the comment about risk is so important, and that's addressed in the standard statement number 5, which talks about dietitians must be aware of accountability, quality assurance, and delegation processes, which brings in the risk as well. So any other comments or thoughts around, or anybody has any experience that they would like to share in the chat?
I think there was a question. I believe it was asked of the previous scenario, but I think it relates to both of them really well. And it was surrounding whether there was any right to refuse to do certain things if you felt like it was far out of your competence and scope.
That's an excellent question. And yeah, if we were to apply the framework of in terms of professional judgment in decision making, and we look at the knowledge component, and a dietitian does not feel that they have the appropriate knowledge or competence to do a particular task, then yes, they have to work with their organization to see, one, how they might get that knowledge or competence. And if in the end they feel that they don't have that, they have to be transparent to say, I'm not unable to do this because I don't have the appropriate competence or knowledge or skills or support, whatever that might be. So very important to address that. That's an excellent question.
Yeah, and I think there are certain instances where, you know, that competence could be acquired, right? You could gain the knowledge and skill depending on what the task is at hand. The comment from the group was about someone being dismissed from their position, and that would really be up to the employer. Now, we know that refusing work could be problematic in some circumstances, and we actually developed a pandemic FAQ to support dietitians when there may be instances and there could be a circumstance where someone is thinking that they may not take on a task or may need to refuse work. So,
and I think employers also have a responsibility to establish a safe work environment for their employees, and this would include things like staffing coverage, infection control. So it's the accountability is on the employer as well as on the individual to sort of have that conversation and ensure that they're safe.
Another interesting question came up, and I think it relates perfectly to applying the framework. Someone asking, what is the best way to evaluate one's competency? And I think that's a perfect way to sort of look at this framework to help guide you through answering that question. It's not really an easy question for us as a college to answer, but it's more looking at your comfort level, your knowledge, your skill set, what's being asked of you, and going through the framework to help you kind of look through that. Anything more to add to that?
No, I think that's great. And when we think about competence, we have to think about evidence too, and evidence-based informed decision-making. So what is the best evidence? What is the best practice? And do I feel confident in my knowledge to do the task? And even if you're not 100% in terms of feeling confident or have the competence, sort of leaning on your colleagues when in doubt, when you have questions, because we don't know everything about everything, right? There might be something that we don't know about, but you have to know how to access that information in a timely way that's safe. So yeah, do you want to add something?
I think that's where that practice wisdom circle comes in. It's really about leaning on each other and supporting each other during times of change. And you know, as we've heard, you know, throughout the pandemic, even you talked about the role and task framework. One of those questions is, who is most appropriate to do this role? So sometimes it may not be you, but maybe a colleague. And in reflecting on our own competence are knowledge, skill, and judgment. Even just also looking at the integrated competencies for dietetic education and practice, those could be helpful too.
Excellent.
Mm-hmm.
Good. Thank you for that.
All right.
Anything
else?
Oh, sorry.
Go ahead.
No, go ahead.
Yeah, I was going to say if anyone else has anything to add. This one specifically, we did receive quite a bit of questions, and when it comes to the controlled acts part, that knowledge that you gain from your coworkers is important, right? And in determining and working with your organization. And Carol, I know we've talked even about liability insurance for this one. Did you want to add that piece?
Yeah, sure. So we've had the question, if I accept the authorization to do a controlled act, am I covered by my liability insurance to do this? And we reached out to some of the liability insurance, actually one company, and the answer is it depends on if the controlled act is related to practice in dietetics. For example, if you have the authorization to prescribe a drug, say vitamin, then that's related to practice in dietetics. So likely you might be covered under the liability insurance that's required for the college. However, if you're asked to do something like the nasopharyngeal swabs, which is outside of practice in dietetics, you may not be covered under our requirement for liability insurance. So it's best to check with your employer and check with your liability insurance carrier to ensure that you're covered, or if you need to check to see if you need additional coverage. Mm-hmm. So the answer there is to check with your carrier.
Yeah.
But that was a really excellent question. Go ahead.
Yeah. Well, I think what this also raises is, as we're dealing with change, ask questions, right? The more questions you ask, the better in terms of, ensuring that you're getting the information that you need. And that's where that knowledge piece falls in, because that helps us making decisions that are based on evidence, right, and information.
Mm-hmm. Excellent questions.
Yeah.
Okay, so should we move on? Right, so we're moving on to scenario number 3.
Yes, so this one is about social media and collegiality. So again, we've situated it in private practice for context, but it could apply to any area where a dietitian is working with a nutrition student. The student has helped the dietitian set up social media accounts like Twitter, a website, an Instagram page, and the student uses the dietitian's Twitter account to voice some concern, and in the process has insulted some dietitians who disagreed with a particular practice approach. So we're going to do our chat storm again and give you a little bit of time here, 30 seconds. I'll start the clock for you to think through what the issues are. All right, that's 30 seconds. When you're ready, start entering your thoughts, and I'm going to ask Samantha to moderate the chat.
Yep, there's a number of comments coming through, and there seem to be a number of people highlighting risk, so allowing someone else to use your social media account, liability, possible loss of confidence, communications of expectations of the student, let's see what else, accountability. Someone's highlighting the nutrition student is not an RD, so are there maybe professional obligations they need to consider? There's a risk for misinformation presented to the public.
Mm-hmm. Yeah, we've definitely heard that in our sessions. There's been questions about the dietitian's policies and procedures. Is there an approval process before? It sounds like in this case, we're not sure, but that may not have been the case. So yeah, who's the accountability part? Where does the accountability, I can't say that word today. Accountability, where does it lie? Yeah, and so responsibility for the platforms. Another thing that came up in one of the workshops was what's the dietitian's knowledge of the platforms and awareness, and so that's an important part of our framework. Maybe we could flip to the next slide and circle back, but the framework. Yeah, so what information do we have and how it works, and what's our obligations here in terms of working with students in terms of risk? That's come up. What other parts are you seeing, Samantha, in the chat? What other pieces coming up?
I think someone highlighted quite rightly about, the dietitian probably should have considered a review practice prior to the student posting.
Mm-hmm.
Someone indicated that even if it was a student, you could treat them like an intern in terms of what's expected of them. Perhaps the student and the dietitian need to have a discussion about expectations and, I guess, the information that they want to have put out there, and a lot of stuff about risk, review, obligation.
Good. Yeah, we've social media is rooted in norms and behavior, and it raises a important point about that teachable moment with the student and in how they're displaying behavior and their messaging, and how information might be misinterpreted, right? How there's no tone there when we're writing things that we might say to someone. How it can be, how words or thoughts or opinions can be taken out of context, can be easily misinterpreted, and a reminder to help the student understand, and that teachable moment of being conscious in the way that we represent ourselves on social media. And while these can be useful tools, they also, and we engage with colleagues, they can also be, they are also public forums where things can get taken out of, can be misinterpreted.
And I think someone's also highlighted the fact that as dietitians, if we're engaging and using social media platforms, you really need to be familiar with it. And so I thank them for highlighting that. I think someone else identified that if depending on the platform, it should be your words and not that of another individual. And I think one person highlighted the need for mending relationships, which I think is really important, right? So if other dietitian colleagues were offended by this, probably as a dietitian yourself need to sort of consider that, and how would you go about that? What would be a next step? What would be reasonable?
Yeah, good point, for sure.
But
and so that repairing the damage that has been done and taking ownership, helping the student understand, but also taking ownership with one's colleagues in that. There should be no disparaging, demeaning or embarrassing information posted about anyone. That's a good point. Yeah. There was a social media session that I went to not too long ago, and 3 questions to always think about when you're posting is it true, is it helpful, is it kind? And that can be some guiding questions that we could use when we're thinking about what we're posting, and also to help that teachable moment with the student too. Yeah. Good. Any other thoughts, ideas from the group? Anyone want to add anything else? Things that may not have been captured? While you're working on those thoughts, I was just going to share our guidelines for supervising learners as a resource too that we have. Again, the scenario didn't specify who, but this is just a regulatory resource for when we're dealing with learners and students. And share that for the group, and it could be helpful for both dietitians and students. Great.
All right.
Shall we move on to scenario 4?
Sounds good. Okay. Scenario 4 deals with long-term care and consent. So you're a dietitian contracted to 2 long-term care homes. Both homes have given you permission to work at both sites following all infection prevention and control measures, such as the ministry requirements, and the guidance for long-term care homes. And you're wondering if you should disclose to the resident or their substitute decision maker that you work at multiple sites before conducting an in-person swallow assessment. So again, what are the issues? And then we'll link it back to the professional judgment framework and then come up with some solutions in terms of how might you handle this. So let's just use the chat storm again.
It started the clock.
Great.
Seconds.
What are the issues?
Thirty seconds is up. When you're ready, start entering your thoughts.
Yep, they're coming in fast and furious. So I think a lot of people are highlighting the need for consent and the assessment of risk. Client safety is highlighted. A lot of people are highlighting disclosure, looking for transparency, honesty. I think trying to find that balance between obligation and what's in the client's best interest. And I think understanding that your client has a right to make a decision, wanting to understand their comfort, wanting to allow them input. You know, I think it's weighing out the risk, right, to you, to the residents, across the different locations and what that involves. Some people are highlighting full disclosure, client safety. So yeah, a lot of people highlighting, you know, the need for risk assessment, risk for spreading infection, and a professional obligation, and then to the client.
Wow, they're right on in terms of identifying the issues, because this is exactly what we heard in some of the other workshops. The client safety, the risk assessment, sort of obligations to be transparent, we heard as well. So, wow, really? So maybe, you go ahead, yes.
Yeah, I was going to say, I think this is a really good example of when we have questions and we're reflecting on our professional judgment to answer them. The framework could be really helpful because, Carol, if you want to flip to the next slide, you know, we have this question, is disclosure required or not, right? And there may be some circumstances where we should, and there may be some when we maybe don't need to. So it's really helpful to kind of break it down and think it through.
So yeah, so in case of how you might handle the situation, really there's no general rule that requires the dietitian to disclose. However, they should consider these components of the framework and also any policies within the organization.
Yeah, and when we think about lots of things move a lot as we're dealing with change, right? Knowledge changes, client input changes, and experience changes, but the professional obligations piece remains unchanged. And, you know, in our risk assessment, in our point of care risk assessment, we might identify something like a client who is immunocompromised, and that might impact how we inform, right? And part of the whole informed consent requirement, right? So where that fits in our professional obligations part.
Any other comments coming from this one?
A lot of people just highlighting, you know, the issue of ethical practice if you think there's a risk. So it's pulling in those elements of professional judgment and your obligations, and you know, like Diane said, like it's really, you need more context even for that resident particularly. How would it be helpful to the client or harmful for them to know that? Would it make them more concerned? And so, yeah.
And I think that the risk is so important because within the process of obtaining consent, part of it is to discuss any materials risk or side effects. So it plays into the other standards as well, that and obligations that dietitians are required to do. All right. Did you want to add anything else?
I think at this point, no. Samantha, do you have anything else you wanted to add?
No, I think that there are a couple of questions, but I think some of it has been answered already. You know, if you felt like there was a risk to do a swallowing assessment, you could reconsider how that's done. There may be other tools that you may be able to employ. So if it is considered a risk, or there was, you know, a suspect COVID case, you might not pursue that. But if you felt like there was nutritional risk to the client to not have it, then that would reweigh the need for that. And then how you talk to the client about, you know, like you said, about what consent looks like. It's not just signing a piece of paper, it's sort of having that discussion with them and determining if it makes sense at that point to do it and they feel comfortable continuing with that. So
I think we've also heard from some of the other workshops is, you know, working with your organization, of course, for guidance, and you know, even helping. There was one comment I remember shared from a dietitian is helping clients understand what measures are in place to keep them safe, what dietitians are doing in terms of you know, maintaining their infection prevention and control measures and all that sort of thing as well.
Okay. Are we ready to move on to the next scenario?
Yeah, we got about 15 minutes left, so on to the last one. Okay, so this scenario is a workplace dilemma. Again, we've situated in, this is about dietitians working in an outpatient clinic. But again, if you want to just think about any workplace dilemma in terms of conflict. So this is about a dietitian who is working full-time, works with a colleague who works part-time, so two dietitians working together, and they receive referrals from various physicians, both in and outside of their facility, to see children who have a variety of issues. The physician who is working at the hospital has been referring newly diagnosed clients and wants them to be seen within 2 weeks of diagnosis. There is a backlog of clients who are waiting for assessments. Some are high priority in terms of acuity. The physician who is referring these newly diagnosed children knows about the dietitian's prioritization matrix and the acuity, but insists that these children be seen within 2 weeks because it is best practice. No additional resources have been allocated, and management encourages you to work it out with the physician. Both the dietitian and their colleague have been working extra hours and feel stressed. So our last chat storm of the day, we want you to think through what the issues are here. And I will just start the timer, just to kind of think it through. That's 30 seconds. So when you're ready, Samantha, what are you seeing in the chat?
a lot of people are highlighting how to manage dietitian stress, revisiting the dietitian hours to help resolve backlog. People are identifying lack of support from leadership, not a lot of guidance, feeling unsupported are some of the issues. Safety and competence are highlighted as well. Communication. So there's some comments highlighting communication between the manager, physician, and dietitians. Competing priorities, time constraints versus best practice. The equity, really good to highlight that. Thank you for that comment. Undue pressure from colleagues. Let's see where else. There are professional obligations and standards. There just may be too many clients to be seen. So how do we resolve that? Looking at workload and professional obligations and balancing that out, and seeking out support where we can. looking at more support, more communication. Can't keep up.
Yeah. Well, that's plenty and great job, everyone. I think, definitely we've heard about communication being really important in this scenario. We've heard from other workshops about workload pressures and the importance of advocating on behalf of clients and for client safety. And so, Carol, if you want to flip to the next slide, I think we can draw parts out of the framework here. When there are workload issues, when there's conflict or differing of opinions, we might have our triaging protocols and our best practices. So that falls into that knowledge piece of what information do we need to make decisions. We've heard from some of the sessions, some dietitians drawing on, other colleagues in similar settings to hear what they might be doing in these circumstances, and to look at the literature, of course, to inform and to have that conversation with the physician. We've heard in some of the sessions client input being an important part, and would it be possible to see these children in a different way, like within 2 weeks virtually, maybe in a group setting? We've heard dietitians talk about that, looking at alternate ways of being able to provide care. Anything to add, Samantha or Carol, at this point on?
No, I think this is great. In terms of resources, we do have an article identifying and managing problems, I think, in the workplace.
Yep, I will share that in the chat. That can be another helpful tool. Sometimes it's really about identifying the problem and working it through. And these are not easy circumstances by no means. They can be very messy and challenging to sort out, and they could take time, right? As we gather more information and as we work together to sort out. This is one where definitely stress comes up, and we've heard that from the group about dealing with workload pressures and trying to meet client needs. And no doubt during the pandemic, this has been an issue. Yeah.
I mean, I think there are a lot of people highlighting about, prioritizing sort of almost like a triage system to ensure that the neediest clients are addressed first. But someone else highlighted advocating for self and other dietitians. And I think that can be difficult sometimes when you're in a situation like this and you're dealing with managers and physicians. And I think that's where you need that to get that support. And if we don't speak up, then it's rather hard to do. Someone else is identifying with this scenario and saying they're experiencing a similar scenario and they feel like they can't rely on their leadership, which has got to be terribly frustrating. And so I think it's about, highlighting what the major issues are, what are possible solutions and or compromises to allow everyone to get, as close to what everybody needs and wants, and highlighting that risk and safety part of things.
So really good, important point, that risk assessment, because that could inform a lot. And in advocating for clients, who we should be putting first and foremost, right? The other part is how that stress trickles down, because it's not just ourselves, but it's also ultimately how it can trickle down to our clients and how our clients can be impacted by that as well.
That's a really thoughtful question.
Thanks for sharing that as well. I think just to add to that comment, it's what can we do next when we can't rely on leadership? And I hope, and I know this can be really hard, but I think it can be empowering for us to reflect on our skills and our strengths that we have and what we bring to the table. I know that sometimes we look for leadership, and sometimes it's there and sometimes it's not. And so how could we lean on each other, colleagues, practice wisdom to help support each other too during these difficult times?
Yeah, I agree.
this point,
Do we
these are
want
not
to?
easy, and you did a great job. You identified the issues. You applied the framework really nicely. You thought through ways that you can handle these tough, challenging situations. We hope that this was helpful, and we'll turn it over. Just if there's any questions at this point, it's about 1:52. We have some time. I think we can just see if there's any questions from the group, and then we can do a quick summary and wrap up. Any questions from the group at this point, either about the framework, about the scenarios, about any thoughts or ideas someone wants to share? And if you've asked us questions and we might not have gotten to you in our chat storm in the flurry of all the comments, we will take a look at that and reach out to you after the session. Maybe Carol, if you want to just flip to the summary and I can just quickly summarize. I think Carol might be frozen. Oh, there she is. Perfect. So thank you so much for your comments today, for your insights. We know that exercising professional judgment means that we're also taking account for things that come our way in terms of actions and our circumstances. And we could exercise excellent professional judgment and there could be adverse outcomes. But out of all the qualities that we have as dietitians, underlying them all is good judgment. And we hope that through this session, you know, we often, a lot of our professional judgment happens on autopilot, but when dealing with new or challenging circumstances, we hope that the framework can be helpful and that we can rely on our skills and our knowledge and that we make careful decisions based on that knowledge, also on being client-centered, on remembering our professional obligations and looking at our experience and making good decisions in order to be safe, competent, and ethical in our practice. These questions could be challenging to sort out. We are here to lend an ear, and we don't always have the answers, but helpful. We're as a resource to listen and problem solve and remind you of our resources that we have available. We know that these dilemmas can be challenging to sort out. We have our professional practice resources and of course our practice advisory service where we take your calls and emails and we welcome them. You will receive an email with the session evaluation. We want to hear your feedback on what we did well and what we can improve on, so please do complete the survey and thank you for your time. This comes to the end of our session today. We want to thank you for participating. Thank you for caring for Ontarians during this pandemic, and always we wish you and your families and colleagues continued health and safety during this time. And we want to thank you again for joining us today.
Thank you so much.
Thanks, everyone.
Thank you. Have a great afternoon and stay tuned for the evaluation. Last final plug, we are holding our Reg Talks delegation workshop coming up soon. So April 14th and 28th. Just check your emails for that information. We will be sending a reminder. If you're interested in joining, we will be holding our Reg Talks delegation standard talk coming up soon in April. So thanks again for today and have a great afternoon, everyone.
Bye. Thank you.
Bye. Thanks.